Dr. Ting Zhang. This video is to help you prepare for your upcoming hip knee replacement surgery. My mother-in-law recently had knee replacement surgery. The questions she asked were probably similar to what you have in mind. No eating or drinking after midnight the night before your surgery to avoid cancellation or delay. Appropriate preoperative preparation can decrease your risk of infection, which is less than 0.5%. Using HIPAA cleanser can decrease that infection risk. Use it at least one night prior and the morning of your surgery. Washing your sheets and using clean pajamas can lower bacterial burden. Please avoid having your pets in your bed for 2 weeks before and 2 weeks after your scheduled surgery. You need a 4-wheel walker for safe ambulation, a leg lifter to help you get in and out of bed or a car, a riser for your toilet seat, and compression squeezers for your calf to lower the risk of blood clots, which is about 3% post-operatively. Compression stockings will also be provided. Post-operative medication include multimodal pain control, minimizing narcotics. On average, patients use 2 to 3 days on narcotic pain medication, with a maximum of 6 weeks. Oxycodone is usually prescribed. Additionally, take Tylenol 1,000 milligrams 3 times a day. Meloxicam, anti-inflammatory, is prescribed, but should not be combined with other NSAIDs like ibuprofen, Aleve, or naproxen. Omeprazole is often prescribed to protect your stomach. You will receive post-operative antibiotics either through your IV if you are at the hospital overnight, or a 1-week prescription if you go home the day of your surgery. Blood thinners are recommended for 6 weeks post-operatively. Low-risk patients take aspirin 81 milligrams twice a day. Zofran is prescribed for nausea, a common side effect of narcotics and anesthesia. Stool softeners like Colace and Miralax are prescribed to prevent severe constipation. A good diet and nutrition supplementation, including protein at least 60 grams a day, vitamin D 2,000 international units a day, vitamin C 500 to 1,000 milligrams a day. Probiotics taken as pills, capsules, or fermented food, such as kimchi, sauerkraut, kefir yogurt, kombucha, can improve recovery and decrease the risk of wound problems, perioperative complications. Nutrition counseling and support are available through our office if you are interested. My preference is to keep your surgical dressing completely clean, dry, and intact for 2 weeks immediately post-op. Sponge bath is probably the safest. If you can seal the dressing perfectly to prevent moisture get underneath the dressing, you can shower normally as well. No submerging of the incision for 6 weeks total. If you get the dressing wet, no problem. Please give our clinic a call and we will switch to clean and dry dressing for you immediately. Walking 5 to 10 minutes every hour can lower the risk of blood clots. Formal physical therapy is not frequently required after hip replacement surgery, but can be assessed at the 6-week mark. Basic exercises are in your preoperative packet. Formal physical therapy should be started within 5 to 7 days after knee replacement. After knee replacement, focus on keeping the knee straight while resting by keeping a pillow under your heel or ankle, not under your knee. This will keep your knee stretched and straight. Do work on bending your knee 5 to 10 times every hour while seated. Follow your therapist's lead. Strengthening exercises that you should do on your own before and after surgery are quadriceps strengthening exercises, straight leg raises, and ankle pumps. Bruising is expected and may track down to the buttock, knee, or foot. If you notice significant swelling at your incision site, contact the office. Manage swelling with a compression wrap provided. Compression stockings, elevating your leg, and using ice packs, and big bag of frozen peas. Cycling on and off every 20 minutes. Avoid dental work for 3 months after surgery. More specifics on dental precautions are in your preoperative packet. If you have any questions, please reach out to the office. From start to finish, it takes a village. You and your family are a big part of our village. Our job is to provide you with the best care while also keeping you informed. Thank you for trusting me with your care.